Now starting. All attendees are in listen-only mode.
Good afternoon. Today is October 30th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, Karyn Harvey, psychologist, author, trainer, consultant, Patricia Sastoque, Director of Programs. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is a handout for this webinar, and you can find it in the handout section in the panel to your right, and they can also be emailed. We are recording the webinar and we'll be posting it on a YouTube link on the DDA website. Questions can be typed in the question box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and thank you. And so I want to thank everybody who is on this webinar this Friday with your continued supports about attending our webcasts that we started in March. I hope that they've been, informative and resourceful. We had Karyn Harvey, Dr. Harvey, present back a few weeks ago, and we thought that it would be good to have her come back again. We received a lot of positive feedback and have her talk today about COVID fatigue. So Karyn, thank you for joining us today.
Thank you.
Let's go to the next slide, Donna. So, as you know, our highest priority is always health and safety. If we all watch the news, we see that it looks like there's an uptick across the country. I think Maryland numbers still have not gone as high as anybody else. Looking at all of the issues on the news with this, and recognizing that, you know, we've got the winter season coming upon us, and obviously with COVID cases, we're concerned with all of this stuff about people's health and safety. We hope that you've had an opportunity to look at the multiple resources either on DDA's website or on the Department of Health's website, so you can use this as a reference and take advantage of that information. I'd like to take a moment to take and say thanks to all of our advocates, family, direct support professionals, providers, and DDA staff, and all our partners who joined in the efforts to keep everybody safe and during this period of time. I think you've done an absolute outstanding job, and you'll see that as we get further down into our numbers and a few more slides that I've been presenting during these webinars. And so since this is not like anything else we've seen, I think our whole DDA community and stakeholders, other partners, other state agencies, local health departments, et cetera, have all pulled together. And I think that, you know, you should be incredibly proud of all the tireless work and the number of hours and the sacrifices that you've endured during this pandemic to basically meet the needs of people with intellectual and developmental disabilities, their families, our providers, us direct care staff, our professional staff in the agencies, et cetera. And so I think that we will continue to obviously do these webinars and keep moving forward. Next slide. So this week, I just wanted to highlight, we sent out a couple of policies. There had been some questions from some of the providers on OHCDS, Organized Healthcare Delivery System. Obviously, we've been working on that. There was an issue about our rates. We've been working on that, and that's basically out. And then there was another issue about using dedicated supports during meaningful day. So again, those two policies are out. You can get to them on the link. And obviously we've got the at a glance documents, and you'll see that Abigail Gadway is a resource there if you've had any information to talk with her about policy stats and how that works, etc. Next slide. So CMS issued some information this week to update the Medicaid telehealth toolkit and additional details. And we know that we've got a lot of information back from individuals, families, providers about using telehealth, using remote services, et cetera. So again, I think that this is a good toolkit for you to take a moment and take a look at. Next slide. And so, again, CMS also released some data and a snapshot to look at telehealth and the increase. And again, I won't read this slide to you, but I would encourage you to take a look at this through the link that we provided on this slide so that you can become familiar and see where the federal government's thinking is on looking at this and looking at resources across all ages. Next slide. So we've got some training coming up on person-centered planning. We know that we are a person-centered agency and obviously we need to then look at the authorization guidance for payments, et cetera. And so that training will be on November 6th from 1 to 2:30. Hopefully we get a good turnout of a lot of folks there for the CCS's provider staff, DDA staff, et cetera. And then here is the link that you may register with. Next slide, Donna. So LTSS training for providers. There's a link to register. To take a look at the personal supports training, we'll be starting now. Excuse me, through December. The sessions are a day long. Supported living will be from the 17th and the 19th. They're 3.5-hour sessions. And we would encourage that you attend and register all your staff who would be doing billings in the system. Next slide, Donna. Next slide.
Donna, can you go back to slide number 9, please? Thank you.
All right, there you go. Thank you. So the updates that we do basically have shown in the central region, we have about 304 confirmed cases. I'm sorry, let's start with South. So in the South region, we have 284 confirmed cases, 98 that are negative, 9 pending, and 17 deaths. East region is 57 confirmed. And then we have 210 negative, 10 pending, and no deaths. Central region is 304 positive, 628 negative, 21 pending, and 19 deaths. And in the West region, we have 50 confirmed positive, 261 negative, 8 pending, and 3 deaths. And as we talk about our direct support professionals and staff within the agencies, in the South region, we have 204 positive staff who tested, 5 deaths. In the West region, 60 staff tested positive, 1 death. In the East region, 95 tested positive and no deaths. And in the Central region, it's 296 positive and 2 deaths. Next slide. So you'll see that this information is from 2 days ago, 10/28. So it's pretty recent data. The pie chart on your left indicates the 17,000, almost 18,000 people that we provide supports to, and there's about 4% of the total population that have tested positive. And on the right-hand side, you will see the total numbers and what the increases have been. Next slide. So as I said earlier, I think that people have done an excellent job with, social distancing and et cetera. I mean, I think that in looking at this, we've had 39 deaths, and it has been no increases in deaths since September 30th. So that 39 is still there. So, everybody's doing an excellent job in social distancing and hand washing, et cetera, et cetera. And so we've had nobody pass away during that period of time. And so then the pie chart on the right shows that we have had 39 people pass away, which is about 5% of the 734 people who have tested positive. And now I'm going to turn this over to Patricia Sastoque for a minute.
Thank you, Bernie. Appreciate that. We're having a slide issue moving forward, but the presentation is attached you can download it. Donna, can you step out and get out of this system and restart the presentation while I talk? There has been a lot of questions that the DA has received about retainer days. And guidance on how to bill, what to do, and the additional information from the DDA. What I did want to share with you all is that under Deputy Secretary's leadership, we are exploring more flexibilities related to retainer days, and we hope to share updates soon with all of the stakeholders. I know that we got some guidance that we gave you, but there is some specific questions that you're asking about the January day, the calendar day, the physical day, the consecutive dates. Our goal for DDA is to advocate to CMS, to Medicaid, to make sure that we can use our 30 days. We're looking at the consecutive, because that's been a big issue for especially residential providers. So as soon as we're able to coordinate an additional conversation with Medicaid and our CMS partners, we will provide additional information. Or the reason why we haven't provided additional information is because we don't want to say, do it this way, and then 2 weeks from now, give you additional guidance to do it back this way. And then it just goes back and forth, back and forth. So if you would just be very patient with us, and we hope that we will be able to provide some final guidance in reference to retainer date and the flexibility. So we are looking and exploring options that we can take here in Maryland in reference to retainer days. So I just wanted to give that an update. I know it's not a slide, it's not a presentation, but I know that several of you have sent me emails and information. So Donna, see if you can pull up before Karyn Harvey's presentation. Perfect. So before we go into this presentation, I really wanted to take the opportunity to echo what our Deputy Secretary has stated, and that is how grateful we are to the folks who get services, the family members, siblings, and our providers and our direct care staff, our direct care support professionals. I think you guys have done a resilient job in really including everyone. The communication between you guys and DDA has been very instrumental. We also know that as you're dealing with what you have to do daily in your business, has been overwhelming. I hear that there's a lot of fatigue in all aspects. And so we thought that we would invite Dr. Harvey to talk to us a little bit about how do we deal with fatigue, and how do we support each other, and how do we continue that partnership. The other piece that I wanted to say is what a great job some of you, all of you, have done with our EVV personal supports implementation, and now moving forward to supported living. It has been something that DDA cannot do by itself. Without you and your support and your commitment, we wouldn't be able to do what we're doing. We really do appreciate the information that you've shared with Kim Gashado, Kathy Marshall, Nick, Onesta. As you share, we are going in and problem solving, reviewing where we are, looking at some ways to streamline the process. And so we really are trying to listen to what you are saying and what you're dealing with. And our hopes is we can't fix everything overnight, but together we definitely can create a system that works for everyone. So please continue to share the good. Please continue to share what's not working so that we can work together. Karyn, as you heard Bernie say, on September 4th, she was invited and she did a still coping with COVID. And she really talked about, you know, some things that we should take into consideration. And then from there, she got lots of emails and said, how did I get Dr. Harvey to come talk to her, my staff or my agency? And so, you know, she's had over 30 years of experience. You heard Donna talked about, she is an author, she's a presenter. She's just well known not only in Maryland, but across the United States and internationally. And you know, I share with you guys that she has a couple of books out there. And she has, I think, an awesome book. It was her first book called Positive Identity Development back in 2009. And it really is about trauma-informed behavior interventions. And so I encourage folks to really look into that. It's very good for anybody who is dealing with some of the trauma-informed supports that are needed. So Karyn, I really do appreciate you coming in and talking to us. And I'm going to turn this over to you. So thank you.
Thank you, Patricia. Thank you so much. I just want to thank everybody, and thank you, Bernie, Patricia, Donna, for being here and for inviting me. But for all of you are doing, it is incredible. It is amazing. I am in awe of you all. And I, when Marianne and Patricia said, well, do you want to say something or give a presentation? Honestly, I didn't. I'm like, no, but then I realized I need to just thank people and give everything I can give, because you guys are giving so much on a day-to-day basis. It is amazing what you are doing. So the first thing I want to say is thank you, and echo, I think that the thank you from Bernie and the thank you from Patricia meant a lot, because they see what everybody is doing and the underbelly of it all, right? And thank you to each region. Thank you to every provider, to the CCSs. I am so impressed that you haven't had any deaths since September. So I've been presenting in a number of different places, and there's sadly many deaths, and the deaths are on the rise of the people we support. In Michigan, they asked me to just do a presentation on grief, because they had lost so many people and the staff were grieving so much. So what you are doing is extraordinary. And yeah, people still are going to pass and things happen, but your efforts speak for themselves. That is amazing. So I did a series of presentations in Texas and they lost so many people. I just wanted to acknowledge that and say, wow. Wow. So COVID fatigue. So one way that COVID fatigue is being talked about is that people are saying, oh, there's COVID fatigue, so they're not wearing their masks anymore and they're tired of it and they want to go to bars and they want to party. I am not talking about that type of COVID fatigue, not you, because you guys are trying even harder. And I was really moved by all the efforts I saw during DSP Appreciation Week, because as much as so many people have so much on their shoulders, they stopped everything to celebrate the DSPs. And that was fantastic. And you did it in a myriad of different ways. I heard all kinds of stories. And I was presenting last week at an agency actually in Maryland. And this woman, a DSP, shared, she said, well, I haven't told anyone, but my brother died last week and my brother-in-law and mother-in-law, who I'm very close to, are in the hospital. And my mother-in-law is going on a ventilator. And I think we were all shocked, right? We all were just like silent. Oh my goodness. Oh my goodness. And, her boss reached out, her coworkers reached out. It was beautiful to see everybody. And they were saying to her, we're there for you. We're there for you. You should have told us. You should have told us. We love you. We care about you. And that's the thing with COVID fatigue, right, is that what happens is people are going through things we don't even know. We don't even know what people are facing and carrying on their shoulders. We don't know what so many DSPs are facing. We don't know the burdens of this. And what happens with the fatigue is that sometimes people isolate themselves, right? And there is so much danger in that. But that's a normal human response to suffering and struggle. Like, no one will understand. I'm just going to have to get through this myself. And that isolation actually makes it worse. So this fatigue that I'm talking about is just being weighted down, right? Withdrawing, feeling heavy. You're not stopping your efforts, you're increasing them. And your efforts are amazing. The results are there. But just that heaviness. And we may find ourselves isolating ourselves. And that's the last thing we need to do. Yeah, we can't be hanging out together as much. We can't socially distance outside because we're freezing now, right? Yay, winter. But what we can do is use our technology, reach out to each other, call someone you haven't heard from. If you see somebody struggling, reach out. And if you're struggling, reach out. Because a big piece of that fatigue is just feeling so weighted down that you withdraw. So number one, connect and be there for others, but let others be there for you too. And oh my goodness, next slide. Enough is enough, right? Look at this demon. Oh my gosh, look at this thing. It's so pretty, really. But this has become the bane of our existence, right? This little virus. And I know that's how so many people are feeling, right? I just can't go on. And I know it's hard supporting, for those of you who are working directly with folks, it's so hard because the folks are done, right? I've had so many people I'm doing therapy with say, I'm done. I don't want to do this anymore. I want to go see my friends and I want to hang out and I want to go out to a restaurant and I want to do this. And it's so hard now to do the long marathon, right? And we thought the marathon was maybe a 5K. Okay, by September, we knew it was a 10K. It's a 26K. That's a long run. That's a hard one. So I want to thank those of you who are directly supporting people. And I want to thank those of you who are supporting the supporters. Because that is so tough. That is so tough because people are like, I can't take it one more minute. And the supporters are tired too. So I want to acknowledge and thank you for that last, that last energy to run those last, 16 miles, or more. My goodness. So next slide. I think the last time I told you my friend had said that we should say that 2020 should be our new swear word, right? So if 2020 is our new swear word, then what the 2020? Really? What the 2020? We thought we'd all be vaccinated by now. Oh, well, we're getting closer. We're getting closer. I keep hearing and reading things. We know a lot of people are very motivated. We are getting closer. Hope is on the way, but it's not that fast. Ruth Bader Ginsburg said before she passed, she rests in peace, she said, it's true you can have it all, but you just can't have it when you want it, right? You can't have it at the same time is what she said. We can't have it when we want it, but we are going to get there. So don't lose hope. We will get there. What the 2020? Next slide. So this is stress is hitting us in ways we never expected. You see poor Mona Lisa over there. She's stressed too. She has to wear a face mask now. So, but the stress wears on you without you realizing it. And stress is a reality. And stress affects health. So I was meeting and talking with a friend who I hadn't seen for a long time. And she asked me something that no one asked me. She said, well, how's your health? I think we don't even stop to ask people. And the reality is that our body stores our stress. And when we talk about it in the context of trauma, right? And if you look at the ACE study, adverse childhood experiences, people get more illnesses with adverse experiences, and then through childhood. But now, as we look at it now, people may be being triggered, maybe feeling freaked out, maybe feeling discouraged, or just the stress of doing your job. I don't know about you, but I'm assuming you probably get about 5 times more emails than you've been getting. Am I right? Or maybe 20, because the emails are flowing, the demands are flowing, but we're not rejuvenating ourselves by connecting with each other. We're not, reconnecting, and we're not taking that 5 minutes to talk at the water cooler or to take a walk at lunchtime with our buddies. And that affects us. So you've got to make time for yourself. You must make time for yourself. And that is my theme of today. You can't get away anymore without making time for yourself, because that stress builds up and it will affect your health. And weird little health things may already be happening, right? I know lots of people are having problems sleeping. Lots of people are having weird health things. And the minute we all get any kind of weird health thing, we're like, oh no, I have COVID. Right? No, hopefully that's not it. But our bodies are talking to us. So if we're not relieving our stress in some kind of concrete way, through movement, through doing a hobby, through anything that releases it, it's going to build up and it's going to affect you, because these are incredibly stressful times. So you've got to schedule that time for yourself. And that's what I believe is really key, because we're so scheduled, right? In front of our computer, and go back to the computer, then do this, then do that. And I don't know about you, but it seems to be, for me, I'm busier, right? Because I have no more excuses. Well, okay, I can turn my computer on. There's not a lot stopping me from that. My main problem is getting away from the refrigerator. That's the big task at hand, right? It's not like I'm traveling or I have a rough commute. But the stress really works on us in ways we don't realize. That's why I recommend that in your daily schedule, you have blocked time for yourself. And that time, you don't have to tell people that that's your time for yourself. Here's what you say: I have an appointment, right? It's an appointment with yourself. Maybe it's an appointment with your bed and you're going to take a nap. Maybe it's an appointment with the road outside and you're going to take a walk. Maybe it's an appointment with YouTube and you're going to watch some funny videos and laugh, because laughter is very healing. Do something for yourself every day that relieves your stress and gets it out of you, gets it out of your body. This is survival, right? And we need to survive. So it's affecting us in ways we don't realize, and we have to schedule time for ourselves. And look at the reality. Next slide. The reality is there are demands. Look at this. I found these pictures and put them together. Thank goodness for the internet. Oh my gosh, right? So how many of you have kids at home that are trying to be in school from home? Oh my goodness. Oh my goodness. I have so many friends that are just tearing their hair out. And there's a boy covering the sister's eyes, right? Or a little kid, and there he is crying. And so many little kids are joining us on our Zoom meetings. And oh my goodness, what kind of stress is this? Oh, it's so hard. I thought it was hard raising my kids and trying to get them to school and make sure they did their homework. I can't even imagine what it's like trying to get them to sit in front of a computer and pay attention. My friend who's a teacher says each day she has at least kids who are just at least three kids are just asleep. And then she has other kids running back and forth, right? And she's like, come back, come back. And it's really tough when some of the kids are in school and some are at home, and oh my goodness. And then, we have our partners, right? We have our partners working right there with us. and we've gotten really intimately familiar with the sound of their chewing and their little demands and their little crazy things they say when they're by themselves. This is something I am very guilty of. My husband will be like, who are you talking to? Nobody. What the heck? What am I? I'm going on and on. This is a problem I have. So we're getting used to each other in ways we didn't quite expect to. This is not easy. This is why you have to make time for yourself. You have to take a minute and just say, I have to take care of myself. So I'm working on a project right now where I'm interviewing a number of families with people, of people who with disabilities. And I'm asking moms who have really accomplished a lot, where the kids are kind of on their way, or, you know, they feel pretty good about what's going on. And I'm asking them how they got there and what their journey is. And I've learned so much. And this one mother, when I asked her, and she's, you know, she had a very, very demanding child, lots and lots of problems. And somehow she made it. And he's 17 now, and she's got him just kind of in a really great place. And he's got some work skills, looks like he's going to get a job, you know, and it was such a long journey and such a difficult journey she shared with me. And so I asked her, well, what advice do you give for parents beginning this journey? And this really holds for all of us, right? Those of us supporting people with disabilities, those family members, those of you, you know, working directly, all different realms, CCSs, everybody. She said, here's my advice. Get a hobby that you love that nobody else is involved in. And I was like, whoa, I've asked all these parents who have been on this journey of raising children with disabilities. I've asked so many of them, what is your advice? What is your advice? And nobody said that. But I thought, that's the best advice I've ever heard. Get a hobby just for you. Do your thing, right? And make sure you do it. Because the thing is, with all of you, I know I say this with confidence because you chose human services. And of all human services, you chose, those of you family members maybe feel you didn't have a choice, but you always do. And those of us working in this field, we chose to work with people who have been marginalized for decades, centuries, really. So we chose the toughest of the tough because this is work of the heart. So I know that all of you are wonderful people who probably have a tendency to put others before yourself. So to say to you, have a hobby that you don't involve anyone else, and it's really important, and make it a priority, is probably a little foreign for a lot of you. But those hobbies can save us. You know, I have a friend who does stained glass, and she's back to doing it again. She loves it. And she's like, I don't know why, it makes me feel so much better. And right now I should be doing more things, but I have to take my time to do that. And I told her, no, no, no. Doing the stained glass is what you should be doing, right? You have to do this because all the other demands aren't going away. So you schedule that time for you and figure out what replenishes you, right? That's how we get through this COVID fatigue. Find your sources of replenishment and recharge. Next slide. And the exhaustion, right? So many people have said to me, I'm just so tired and I don't know why. I'm so exhausted and I don't know why. And it seems like we're sleeping better, but sleep has gotten harder. So many people that I work with are telling me about sleep problems. But the exhaustion is more than whether or not we're sleeping. It's a deep, deep tiredness, right? A deep fatigue, because you're pushing yourself harder than you realize. I had talked about last time our subconscious and conscious brain. So it's exhausting to constantly be figuring out what's coming next. A year ago, we knew what was coming next, basically, right? We get up, we go to work, we know what our commute is, we know what we need to do, we know what the schedule is, we know what's coming up. And so our subconscious has constructs, right? Boxes of reality, all organized, where you just can relax and not worry. And then your executive functioning, your frontal lobe, can plan, can think, well, I need to get this done, I have to get that done, and I'll do this and I'll do that, and think that way with hope, right? In a normal world. But our world has been turned upside down. And for a while I was saying, well, now we have the new normal. But it's not even that, because the new normal doesn't even stick, right? And now it's different. And now we have this second wave. And now we're being restricted again. And each time we think we can predict what's next, it changes. So that's very hard on your subconscious and conscious. That in itself is exhausting, because your brain is working overtime, reorganizing your constructs, rethinking reality. My friend, Dr. Stacy Danvers, she always says, it's actually the now normal, because every day you wake up to a different normal. And every day your brain has to reorganize itself. And that's exhausting. And it's also very tiring to try to connect and work and do what you were doing in person on the computer. And even though we say and we expect of ourselves that we should be used to it by now, it's very hard, right? We can't. So you have to give yourself a break. You have to give yourself breaks. You have to schedule appointments with you, with your road or bed or, craft stuff. And those appointments are very important. And it's all about taking care of you to replenish. Okay, next slide. Burnout is a reality. Oh, wait a minute, one slide back. Thank you. So, with this, we see with burnout, we have so much, right? And burnout is a true thing. So I've had, people that have said, well, people say they're burned out, but what's burnout really? No, burnout is a reality. And right about now is the time when probably a lot of you are experiencing burnout. Right about now. Because we had some hope. We thought, okay, we're going to make it to the fall. Well, the fall is here. And now we're looking and going, oh my goodness, we have another wave, or it seems like kind of the same wave, right? Oh my goodness. So we start to lose hope. That's why I have all my hope signs. I got more. Because hope is really important. And that's a big piece. These are the signs of burnout, right? So to have that, what I called, and we talked about last time, that sense of impending doom. If you start seeing yourself thinking over and over again, this isn't going to change. This isn't going to work when you start a project. Oh, this will never work. Why am I even bothering? If those thoughts start coming up, that's a sign of burnout. That when you felt for a while that you were going to be able to do something, and all of a sudden you start to think it's not going to work, it's not going to happen. Why am I bothering? Why am I bothering? If that thought keeps popping up, you need a break. You need a break. Because that sense of doom, that sense of hopelessness is a big, big sign of burnout. Because when you've worked and worked and worked on something and it hasn't all broken through, we get that deep fatigue. So when I talk about fatigue, it's a deep fatigue. It's not just I didn't get enough sleep last night, right? It's the exhaustion of rolling the rock up the hill, right? And then it comes back down, rolling the rock up the hill. It's a very difficult time. And if you're not doing something to take care of yourself, it's going to hurt. And even when you are, it's not easy, but you got to take that time for you. And we've got to support each other, because absolutely nobody is at their best right now, right? So my one friend was saying, I'm yelling at everybody. I don't know why I'm yelling at people. I never yelled at people before. My other friend, she said, well, I'm yelling at people, and I'm yelling at people I love. So I had this, I mean, all these people are just losing their tempers, and sweet people that I love are telling me how they're yelling at everybody. I'm like, oh, that's so sad, but don't yell at me, okay? So my one friend said, well, I just started calling my representatives so I could at least yell at the right people. She's yelling at all of them, yelling at their secretaries, right? Their administrative assistants is who she's yelling at. So I'm getting it all out there. But this fatigue is deep, and we have to recognize it and understand the signs and symptoms of burnout, hopelessness, fatigue, and a lack of motivation. So it's very hard. It's very hard to start something new right now. And there's a lot of new demands, and there's a lot of changes, and the changes come fast, and they come on many levels. And that is very difficult. And you might find yourself just wanting to give up, just saying, well, I can't do it. There's no way, right? And that, again, is a sign of burnout. Thinking, well, why should I even bother? What good is it going to do me? So one psychologist I heard training said, well, make a list of 10 things to do every day, and just do 3. And if you do 3, congratulate yourself at the end of the day. I like that. Because I'll make my long list and then I'll be like, oh no, I didn't do it. And then I'll feel really bad, right? So these are signs of burnout. So what we have to do for ourselves is take care of ourselves. And I'm going to go through ways to do that. Understand that the demands we may be placing on ourselves are too much, that we have to lower the demand level. And I know all of you are saying right now, I can hear it. You're saying, well, I might lower the demands, but my boss wants this, and the individuals I'm working with and supporting need that, and my staff need this. You'll get there. Take it down a level, because these demands you place on yourself, sometimes it makes you less productive. I know I've been through that, right? When I just stress so much about what I should be doing that I end up not doing anything or just stressing. So we have to take a minute. You'll actually get more done by taking care of yourself. Mark my words. Next slide. You've seen this before. I put this in every single presentation I have. Sometimes it's okay if the only thing you did today was breathe, right? That, you know, some days are just going to be like that. Some days it's so overwhelming that it's great that you breathe. And now I want to talk about breathing. So last time I taught you the butterfly, right? So next slide. Now I'm going to teach you another technique for de-stressing. And it's called square breathing. Some of you may know this, right? So you can draw a square if you like, or you can picture a square, right? So I have a square here. And if you want to, you can practice with me. This is a wonderful, wonderful technique for de-stressing. Again, you can schedule 10 minutes of square breathing for every hour if you want. That's a great way to take care of yourself. At least try to do it once a day. It also is very effective if you can't sleep. If you wake up in the middle of the night frequently and you're trying to get back to sleep, try this technique, okay? So you focus on the first corner, right? So we're going to focus on that upper left-hand corner, and we're going to begin. And you breathe in for 4 seconds. 1, 2, 3, 4. Then you hold it for 4 seconds. 1, 2, 3, 4. Then you breathe out for 4 seconds. 1, 2, 3, 4. And hold. 2, 3, 4. And this is incredibly effective. And you do it again. Now, I know some people that will do it for 7 seconds after you get used to doing it for 4 seconds. So let's try it one more time. So breathe in. 3, 4. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold. 1, 2, 3, 4. And when you're breathing out, you should expel all of your air, right? Get it all out. And when you're holding, make sure all of that stale air is out. Because what we've learned through Qigong and Tai Chi and other practices is that we carry around a good deal of stale air, right? Which is not good. So you want to be constantly taking deep breath and breathing out. And that's just in the course of the day. But this square breathing really forces you to expel that stale air and to take in fresh air, which really revitalizes your whole system. We are based on breathing, right? And respiratory health has become very critical right now. And this will increase your respiratory health as well. So try square breathing. Next slide. Solutions. Okay. I can't tell you how many of you, people I know are listening, have told me that you haven't had a vacation all year. Somebody that's even turning these slides said that. Yes, I mean you, Donna. So vacations are so critical. Vacations. Vacations. I know we're not going on a cruise. I'll probably never go on a cruise again after what I saw in the beginning of this thing. But the reality is you need a break. Now, I hope everybody's not going to get mad at me for telling their staff to all go on vacation. And I hope you all don't do it at the same time. But honestly, this is a big piece of burnout, is not taking a vacation. So I worked at one place where they started paying people for their vacation time, doing a payout. And so lots of people didn't take vacations. Incidents went way up. Staff were exhausted. They were getting into power struggles that they wouldn't have gotten into if they weren't so exhausted. And the boss realized it. He was a very smart man. And he said, you know what? I'm only doing vacation payouts if you can show me that you've taken at least 2 weeks in a year. You know, because they would get 3 and something. So he changed the rules because he realized he was having more incidents, more difficulties, more problems when people didn't take breaks. So I know this is hard. I know scheduling wise, it's not easy, but it is critical. Hobbies, as I said before, you know what's really fun? Go back to a hobby you used to have. So I have a friend who's Zooming constantly. She's a person-centered thinking trainer, and she does it all over the country. And she started knitting again, and she's knitting while she's training, and no one can see her. I'm not going to tell you her name because otherwise that would be bad. I think that's so fun. She's like knitting away, knitting, knitting, knitting. Nobody knows. Music is so important. Music actually changes our brain. It rewires your brain to listen to music. Take time and listen to the music you love, right? Playing rewires your brain. I should have playing on there. That's my new thing. I read this great book by Stuart Brown called Play. It's so fantastic. Playing, listening to music, exercising, moving. These things all revitalize your brain connections. And then, of course, the movement is so critical for your body. So we need to release that stress. So find something, some way, something you like to do. If you like to walk, walk. If you like to run, run. If you like to do yoga, please, please do it. And if you don't like to do it, find something you like to do, because I tell everybody to do yoga, but I don't do it because it hurts and I'm really lazy. But walking I can do. Okay, next slide. And we have to look at emotional self-care, right? Emotional self-care means not beating yourself up. And this is a really important point. And I really want to drive this home. Respecting yourself and your efforts. So many of you, some of you are my friends, you just talk about what you haven't done. You talk about what you didn't do right. You beat yourself up all day for what you forgot to do or what went wrong. and you don't look at what you did right. You don't celebrate the great things you did. You don't stop and say, wow, it's amazing. If I told you a year ago that you would be doing what you're doing now, oh my goodness, you would have said, I bet you would say, no way. There's no way I can't do that. I would have quit by now. But you didn't quit. You're amazing. You rock. You're still here. So congratulate yourself. Stop thinking about what you did wrong. There's no point. And plus, you're amazing for what you're doing right. Look at what's right. Treat yourself like you would treat a dear friend. I'm going to ask you, would you say to yourself some of the things you say to yourself? Would you say that to a friend? Would you say to a friend, well, what are you doing now? Or why did you forget this? I can't believe it. No, you wouldn't. I bet you wouldn't. Treat yourself like you would a dear, dear friend. Hey, you're doing a good job. Wow, look at yourself. You got to do some positive talk. Some positive self-talk goes a long way. And it may seem like a silly thing to do, but it's very impactful. Tell yourself what you're doing right. Take a minute and congratulate yourself. If you're constantly telling yourself what you're doing wrong, you're beating yourself down, you know, and you wouldn't do that to your best friend. You wouldn't even do that to someone you only mildly like. But sometimes you do it to you. Maybe not all of you, but you guys know who I'm talking to. And it's time to really celebrate yourself. Look at you. It's amazing. Exercise boundaries. It's okay to say no. It's okay to say I have that appointment with myself and not tell somebody that it's yourself that you have the appointment with, but I'm sorry, can't do it. Have a boundary for you. And then I want to give you 3 minutes. No, I'm only going to give you 1 minute because we have a really nice video Patricia found. And I want you to think of 3 things that you really appreciate about yourself. Three things, right? Are you thinking of 3 things? I hope so, because you've got 20 more. But it's time to acknowledge how amazing you are. And the fact that you're going through a pandemic, this is historic. People will look back on this as a time of history, and the heroes are the people who were able to support folks with disabilities and make their lives continue, help save lives, keep things going, keep all the balls in the air, juggle it all, and not give up. And that's what you're doing. So it's time. It's time to celebrate you. It's time to appreciate you. Know your worth and add tax. So you are worth it. You're worth taking care of yourself. You're worth being kind to yourself, and you deserve it. So that's my piece. And now we have a short video. I think.
So Donna is going to be
Just-
launching the video. Go ahead, Donna.
Just give me a sec.
And then we'll open up for questions. And I do have some questions in the chat box before we end the call. So I'll make sure we do those.
You're worth it. 3 words we have all heard at least 1,000 times, right? You're worth it. But do you really understand what that means?
can't hear. I can't hear.
Thank you, Donna. For those of you who might not have been able to hear it, please feel free to download it. I think it's a pretty powerful 2-minute clip. So I'm going to read some questions here that some folks have asked, and then we'll go and then we'll end. So one of the questions that was asked is, where do you report when there's staff or people who are COVID positive? And so we want you, of course, you know, the findings of the results go to the health department from the doctor where the testing happened. But for us, we want providers to, or people in self-direction, to report this to your regional office, to the QE director or the QE nurse, to make sure that we are aggregating the data and the information that the Deputy Secretary is reporting every 2 weeks that we have this meetings, this webinars. The other question is, would DDA consider extending the deadline for submitting of annual cost reports for FY20 due to delays in submitting the error updates for retainer days for FY20 in fourth quarter? So I talked to our Director of Operations and Physical, and Valerie has stated that the cost report instructions are going out today. The deadline is December 31st, but the DDA is allowing a grace period until the end of January. So again, they are due on December 31st. The DDA is allowing a grace period, and the instructions are going to go out today for folks. The other question, Bernie, this is a question for you. And the question is, will DDA be providing another distribution of PPE to providers anytime soon with the upticks in case in Dr. Fauci's guidance, the DSP should be wearing surgical masks? Supplies are low. So Bernie?
We've sent out 5 rounds so far. I don't know how much supply is left. I will have my Chief of Staff, Tanya Ferguson, follow up with where we get the PPE from within the state. That's a good question, though.
Okay.
Patricia, I don't know if you can hear me, but I think you're on mute.
Oh, sorry, guys. So the other one, the last question here is, can we share the additional flexibilities that we are looking at for retainer days? That's a great question. As you heard us say in the Deputy Secretary's guidance, is we really are looking at the 30 days and the issues that we're having with the consecutive, and trying to make sure they're not consecutive and get some additional guidance from CMS. So those are the flexibilities that we're looking at, being that we're getting a lot of questions about this. So as we get more detailed information, we will share with all of our stakeholders. So thank you, Donna, for letting me know that. And other than that, I really want to thank you all for participating in our webinars. And if you did have a problem hearing the video or any of the information, everything can be downloaded from the handout sheet. So thank you all. Have a wonderful weekend and happy Halloween. Thank you.